My name's Tessa Parkes and I work for the University of Stirling, and I run a research centre that again tries to do some of this work of personalising policy and practice and research around people who use drugs. And we're going to be speaking about drug checking today, and I'm going to hand over to Danilo to start us off. Thanks.
Hi everyone, really glad to be here. And as Tessa said, we're going to be presenting on the Scottish Drug Checking Project and some of the process of moving from this research project into implementation and service delivery. So we're presenting on behalf of a larger study team, and here's the team for your information. So to start the presentation off, I'll provide a little bit of an overview of drug checking in terms of global provision, different models of service delivery, and some recent policy developments as well. So to start with the basics, as I'm sure many of you will know, drug checking services enable people who use drugs to submit a small amount of a substance for analytical testing, and they provide information about the contents of the sample along with harm reduction support and advice. The number of drug checking services operating globally has grown rapidly in recent years due to kind of increasing concerns around the variable unregulated drug markets and the increase in number and type of novel psychoactive substances. And services are operating in Europe, North, Central and South America, and Australasia, with the majority of these services operating in Europe. So on the slide there, you can see an infographic developed by Fiona Measham and Monica Barrett, which just outlines some of the key features of drug checking services. So drug checking services aim to reduce drug-related harms by providing people with accurate information about the contents of a drug, and substances are submitted from the public voluntarily. The service returns results to that individual along with tailored harm reduction support. And on the kind of top right of the infographic, you can see some of the ways which drug checking services models vary in terms of service delivery, and we'll discuss this a wee bit more shortly. So one broad distinction between drug checking services, and probably a good place to start, and again I'm sure many of you will be familiar, is between festival-based and community-based drug checking. So festival-based drug checking, as the name suggests, are temporary services set up at festivals and nightlife or music events, whereas community-based drug checking services are generally operated at fixed site services in a community, and they're often co-located with other low-threshold harm reduction services and organisations. And obviously there are a range of different considerations in terms of service user demographics and service model and delivery for these two types of drug checking. Although there's been a long history of informal and basic drug checking going on in communities really since the 1960s, the first formal drug checking services were set up in Europe throughout the 1990s and early 2000s due to concerns about increasing use of drugs such as MDMA associated with nightlife and rave culture. The longest established and probably best known of these is the Drug Information and Monitoring System, or DIMS, which was set up in 1992. DIMS is a national network consisting of 31 drug checking facilities in 29 locations throughout the Netherlands, and these services are usually co-located with drug treatment services. DIMS is funded by the Ministry of Health and local governments and is quite an established part of the Netherlands' public health approach to drug use. And as I've alluded to so far, drug checking services really vary considerably in terms of how and where they operate. And on the slide there, you can see some of the main areas of difference. So services differ a lot in terms of location. For example, some services operate in standalone offices, some in drug treatment services, and some in low-threshold harm reduction services, for example, supervised injection sites. And another important difference is the types of equipment that are used. So there are lots of different types of equipment with varied strengths and weaknesses, and this really shapes the kind of results and information people get. And this also shapes how quickly people get the results, and that's a really important consideration when thinking about who the service wants to engage. Relatedly, services use different methods for communicating results, so they might provide them in person, over the phone, or online. And services differ a lot in terms of the demographics of service users they get. So services in Europe have tended to attract more recreational drug users, testing things like MDMA, cocaine, and amphetamine. And contrastingly, in North America in recent years, and thinking about the overdose crisis and the role of fentanyl, services are often aimed at kind of more marginalised groups. So an example of this is that services are often located in supervised consumption sites, which attracts a lot of opioid users who are maybe at higher risk of experiencing drug-related harms. And this will shape things like what equipment is used as well. And the last two factors on the slide there are funding and laws and policies. So this really relates to government policy and legislation and how supportive they are of drug checking. And we'll cover some examples of this shortly. So the emerging evidence in relation to drug checking services tells us that they might have kind of harm reduction impacts at a number of levels and across a kind of wide group of people. At the level of the individual, drug checking services can impact on drug use patterns and the adoption of harm reduction behaviours. For services, drug checking services could facilitate increased uptake of harm reduction interventions and increased staff knowledge and practices. Drug checking can also feed into systemic capacity for drug market monitoring and communication by providing information on drug trends and facilitating communication around this information. And also things like early warnings to a wide range of groups. Drug checking might also impact on how people who use and sell drugs interact with the drug market and shape drug buying and selling practices in a number of ways. And lastly, at the population level, drug checking might have an impact on indicators of harm, such as drug-related hospitalizations and overdoses. Although it should be noted that there is no evidence yet which kind of demonstrates that drug checking has an impact on these population level outcomes. The evidence base on drug checking is still emerging, but you can see that it has potential to have a quite wide-ranging impacts across a number of individuals, services and stakeholders. And I'll now move on to very briefly provide an overview of some policy developments in relation to drug checking. And as the quote on the slide there indicates, drug checking services have, with some notable exceptions, such as DIMS in the Netherlands, have largely been grassroots services with limited government funding that have kind of operated on the periphery of public health responses to drug-related harms. And this has had an impact in relation to the legality of services, their funding and security, and in terms of the sophistication of their operation, in terms of the equipment being used, and things like that. But there is some evidence that this picture is changing somewhat, although this obviously depends according to the particular context of a given country. But drug checking services do seem to some extent to be increasingly recognised by policymakers and government as important harm reduction interventions, given the increasingly volatile, unregulated drug markets. So an example of this is that in New Zealand, they're the first country to explicitly legalise drug checking, provided that it's carried out within a specific licensing framework. And in Canada, community-based drug checking pilots were set up in 2017 in Vancouver, Toronto and Victoria as part of a broader response to the ongoing overdose epidemic. Now, these services are funded in Canada by Health Canada, and services have legal exemptions from the Controlled Drug and Substances Act, and this allows them to operate within a legal framework. And this funding and security has really enabled a lot of innovation around models of service delivery and drug checking equipment. So, for example, in a Canadian context, Substance Drug Checking Service in Victoria has pioneered a number of technical and service model innovations. Their funding's enabled them to use very sophisticated equipment on site and provide detailed results on drug contents and strength in a very short time frame of 15 to 30 minutes. So they're really setting the benchmark. And as well as a central site, they now set up a number of rural sites to expand the reach of drug checking, and they've really been leading the way in terms of developing suitable equipment and methods. In terms of policy developments and the broader context of drug checking services, it's also important to note a range of potential legal considerations and challenges in relation to the operation of such services. And again, this varies across different countries. So drug possession remains a criminal offence in many countries, as we all know, and I won't go through these legal considerations in much detail, but the two main issues really relate to the legality of conducting drug checking for the service and for the staff, and the second is the protection for service users from surveillance, being charged, and so on by police when entering or leaving the service. And the last issue to consider, to provide you with some context, is the state of drug checking in the UK. So again, I won't go into this in detail, but you can see QR codes which provide a kind of comprehensive overview of drug checking going on in the UK. So the Loop, a charitable organisation, have been providing drug checking at festivals since 2016 in the UK, and they're currently preparing to launch a regular community-based drug checking service within the Bristol Drug Project, which is a third sector service, and this will be fully funded by Bristol Council. And there's also Wedanos, which is a Welsh postal drug checking service, which has been in operation since 2009. People post samples of drugs to them, and then they publish the results online. So there is drug checking going on in the UK, but it's quite small scale, and it's not yet a kind of well-established and well-integrated harm reduction service. And as I've noted, there's currently no drug checking in Scotland, but services are being planned, which we'll move on to consider shortly. And this graphic from the Loop just shows some of the work they've done in terms of providing drug checking at festivals in England, really leading the way and showing how drug checking could be operated within a UK context. So now that we've looked at the wider context, let's move on to discuss the Scottish Drug Checking Project. So the project was funded by the Drugs Death Task Force, / Scottish Government and Cora Foundation to explore barriers and opportunities to establishing drug checking in Scotland, to build and disseminate evidence around drug checking, and to inform implementation of these services in Glasgow, Aberdeen and Dundee. And it's been a 2-and-a-bit-year project and is completing at the end of this month. So shortly, Tessa will be discussing the implementation side of the project, so working with local and national stakeholders to build evidence and support the development of these services across the 3 cities. So I just want to briefly touch here on the research side of the project. A key aspect of this has been that we conducted 43 interviews with participants across the 3 cities, and participants were drawn from 3 groups. So professionals, including NHS staff, third sector and police, people who use drugs, and family members of people who use drugs. And we explored a range of issues, including where drug checking should be delivered, how it should operate, who should be involved in its setup and delivery, policing and legal issues, and a range of other implementation factors and considerations. We've also reviewed the international literature to ensure that delivery in Scotland would be based on a robust evidence base. In terms of outputs, we've had a published paper based on our interviews with police participants and their views of the challenges around policing of drug checking services, and we'll outline shortly how this has kind of helped feed into national policy and debate. And we've also published a paper which conducted a realist review on factors which could increase engagement in community-based drug checking. And we're currently submitting 3 other papers, one looking at service models and where drug checking should be located, one outlining implementation considerations, and the last looking at the potential harm reduction impacts of drug checking in Scotland. And we've produced a number of briefings and video outputs for local implementation groups and the general public, which you can find on the Scottish Drug Checking project website. We won't be outlining the findings in any detail here today, but we will provide QR codes at the end of the presentation. We'll be focusing more on how the research and engagement with a range of relevant stakeholders has helped inform and support the planned implementation of drug checking in Scotland. And I'll now pass over to Tessa to outline some of these considerations.
So Dave said, don't spend too long on the academic evidence, just get down to what we're doing and how we're doing it. So, sorry, we've spent 16 minutes on that. But hopefully that's given you a strong basis of understanding some of the complexity of the field. So yeah, I'm going to now speak about, left my notes down there, so I'll speak about what we've done to build in partnership and the buy-in to make it happen on the ground from the get-go. So this was a Drugs Death Task Force funded project, Cora Foundation and Scottish Government. So just as a big thank you to funders from the start for believing in the project, which did feel ambitious for us all, ASAC it in that first meeting. I felt the responsibility of getting this going. So partnership was built in from the very start. It was a collaboration, as many of these complex projects have to be able to deliver when the time comes to get going. So it was a collaboration between universities, national organizations such as CREW, Emma's here, which is wonderful to see, leads across 3 cities, and we've certainly got Glasgow colleagues present today if people have questions about that. And also international and UK experts. So I don't know if anyone remembers Bruce Wallace speaking at the 2016 conference that Drugs Research Network organised in Dundee. Some of you were there. So he inspired us really to look at, and Bernie as well, to look at different frameworks, including health equity framework, and talked about the work they were doing on drug checking and piloting at that stage. So it's like, well, if they can do it, then so can we. And it was wonderful for Danilo to go through the slides and to convey some of the journey that they've been on. It's not been an easy journey. These are not easy journeys, posting drugs through, distributed models, all the things that they're trying to figure out. We're learning from them. So we brought in that international advisory role from the beginning as well. And we have Fiona Mission from the Loop feeding in too. Thank you to those in the room who are part of our partnership as well, wider advisory group, including people partners, toxicology partners, and Police Scotland. We've got a lot of expertise to do this work. It's really just bringing people together and thinking about some of the tricky issues for the cities and then for the national side of things as we went along. So we've done that for the last 2.5 years too. We've had a lived experience of family reference group inputting throughout, and Danilo's been leading that with Josh Dumbrell, so we can speak about that if anyone's got any questions about how we involve people throughout. We've also done some comms work, knowing that this can be tricky to get the press on side, so we have done some, not that much and not really enough, but we've done a bit. I have got an ambivalent relationship, as many of you know, with speaking with the media, so I haven't done much of it, but we've done a bit, and we have laid a bit of a foundation for the work with local and national press in the city and in the cities as well. We've had city-based local decision-making groups, which have been led by the alcohol and drug partnerships within each of the cities, and they've had lively feed-in throughout, but that's an ongoing process, and as it isn't finished, because the responsibility is now very much within the cities to take the work forward, but they've been engaged and lively and passionate partners in this work, and it's been amazing to work alongside people that have really masses of other responsibilities and who are still spearheading this work to get services on the ground. Yeah, we've had some brilliant conversations with our partners in Police Scotland and the Crown Office, COPFS, on the thorny issues. But actually, having those conversations monthly is really the way to go, rather than to be leaving all these difficult things to the end. I'm not saying we're there, but we've made significant progress. And the conversations around the safe consumption site, the DCR, has certainly helped us. But obviously, we're also still waiting for news on that. I see Orlando's gone, but it would be good to maybe ensure that we have that on the agenda today in terms of some of our questions. Yeah, and regular meetings with the Drugs Policy Unit and the Minister as well regarding funding, so that we're not, the ADPs were really clear, this shouldn't be like a couple of years of exploring and not actually delivering on the ground. So we've had our feet as researchers held to the fire, and that's absolutely the right way to go about things, particularly a couple of months ago by Angela Constance, like when are these Home Office licenses going in, and translating our desire in Scotland for these services direct to ministerial colleagues at the UK level, speaking about some of the points that Roy made earlier. Okay, so that's some of the setup for success. So I just put a few of our ventures into the media, but we've had some really sympathetic reporting. Actually, I left off the Helen Puttett did a really nice piece in the Times, and then of course the header ended up, making me fall out of love with the piece immediately, because the word addicts was used again. However, we're part of a sea change in relation to media representing these issues, but I think people have done a pretty good job, and we've tried to also talk to them about their responsibilities in properly reporting, which is not something that's come up in the morning presentations, but a really important thing for us to be educating and those that represent the issues, not just complain about it. Oops, sorry. Oh dear, that just said the plan that was a nice little piece that said the plan that you have been preparing for is now coming to fruition, and it's a Chinese cracker. But you'll just have to imagine it. Okay, where we are now, very quickly. So, hurrah, we got news that we've got funding from Scottish Government for 3 city pilots, and the notes are running on for me, yeah. 3 city pilots in the 3 cities, and also a national service for confirmatory testing, which is really exciting. We actually only heard that a few months ago, so we are able to proceed. The cities are able to proceed. Scottish Government is now project managing a national implementation group of all those who've been involved in the work so far, and those that need to be involved coming forward. And I'm glad to say that I think it's. Am I able to say that Crew are? Well, I'll say it anyway. That hopefully Crew will be chairing. And Emma will be chairing that with an independent chair. We've already got an amazing programme website. Please go and see it, that Crew have put together for us as our key partners. And there'll be a mailing list for anyone who wants to know more. If you can just register on the mailing list when that comes up, but just contact us if you want to know more information. All of the outputs that Danilo spoke about are on the website. If anyone wants to have a look at the papers, please contact us and we can get them over to you. And there's going to be an evaluation of all elements planned according to Scottish Government, just waiting to hear what that will look like. So that's the drug checking project. Very passionate about getting it out into the services, and happy to take any questions. Hopefully you'll be able to see those nice links to papers, and if you can't, happy to share them. Thanks very much.